everyone, I'm Anastasia signing in from Nora's. In today's session, we will be dealing with a very small topic, which is the Sitz Bath. Sitz Bath or hip bath is defined as washing or bathing of the perineal area in a sitting position. It is in this procedure that the patient will be immersed not only the perineal area but from the mid-thigh to the hips. This procedure is being performed in order to relieve any discomfort or pain that is present in the lower part of the body that can result from certain problems such as the presence of hemorrhoid or even anal fissure. So I hope you have got the definition. Now let us move on to the purpose. Why do we provide the Sitz Bath? Here there are various reasons for which this is done. The first one is to relieve pelvic congestion, to treat the presence of dysmenorrhea, to relieve pain which can occur after any surgery has been performed involving the perineal area, to promote the drainage of rectal abscess and hemorrhoid, as well as to relieve the presence of pain following certain diagnostic procedure such as cystoscopy. So these are the various purposes. Now let us move on to the general instructions. As a nurse, when the patient takes the Sitz Bath, care must be taken to prevent chills, which can happen if the water is over cold, to prevent burns, which can happen if the water is too hot, and even to prevent fainting. Here we must make sure that the temperature of the water or the solution should be between 110 to 115 degrees Fahrenheit or 43 to 46 degrees Celsius. So even after the solution or the water has been provided for the patient, we still need to check the temperature of the water in between, and if required, additional hot water can also be provided, because as we know, even if we provide the hot water, it can get cold. So in order to prevent that from happening, in between the procedure, we can assess or we can check the temperature of the water, and additional hot water can also be provided. We should also keep in mind that the duration of providing the Sitz Bath must only be for 15 to 20 minutes. And here the sterile solution which we will be providing must be stored in a sterile container in order to prevent the transmission of microorganisms. So there are three main solutions which can be used while we are providing the Sitz Bath. The first is the potassium permanganate, the second is the boric acid, and the third is the Uzole solution. So depending on the physician order, we will be providing the prescribed solution. Now, this Sitz Bath, although it has various purposes, it is still contraindicated in some patients. Here mainly people who are pregnant, that is during pregnancy, this Sitz Bath will be contraindicated. If woman is menstruating during the menstruation, again, this Sitz Bath cannot be provided. If there is presence of renal inflammation, as well as if there is increased irritability in the genital organs, then Sitz Bath is again contraindicated. So here, if a person is having renal failure, if a person is having increased irritability in the genital organs, if a woman is menstruating, or if she is pregnant, this procedure is contraindicated. Again, here, before we perform the procedure, we must first perform the preliminary assessment, where we need to check the patient's identification, the doctor's order for specific precaution, the condition as well as the diagnosis of the patient, the type, the duration, as well as the medication, or we can say the solution which will be used for the procedure, the patient's self-care abilities to follow the instructions, as well as the articles which are available in the unit. Only if all of this has been confirmed, then we can start with the procedure. Here again, before we start, we need to prepare the patient and the environment, whereby we need to explain the procedure to the patient. We need to provide privacy in order to enhance their comfort level. We need to arrange all the articles which will be required for this procedure. We need to put off the fan as well as close the window of the room where this procedure will be carried out for the patient. We also need to check the temperature of the water using a lotion thermometer. And we also need to position the patient comfortably. So this is how we can prepare the patient as well as the environment for this procedure. Here, as I've repeatedly been saying, that we need to arrange all the articles which will be required for this procedure. So here, this include the basin or the bathtub, bath blanket and safety pin, bath towel, the Macintosh, the lotion thermometer, as well as the rubber rings. So these are the articles which would be required. And once it has been arranged, then we can start off with the procedure. As in every procedure, the first thing that we must do is we must perform hand washing. Why do we do it? We do it in order to prevent the cross-contamination. And then we must place the bath towel and the rubber ring at the bottom of the tub. Then we can fill 1/3 to half full of water in the tub. After the water is filled, we can then add the required solution. And before we assist the patient to the bathtub, we must check the temperature of the water using a lotion solution. Here, as we have discussed, that the temperature must be between 110 to 115 degrees Fahrenheit or 43 to 46 degrees Celsius. So here, while checking the temperature, we must make sure that it is between this reading in order to prevent chills or burns. Once the patient has been assisted to the bathtub, we must cover the patient with the use of a bath towel. We must leave the patient in this position for 10 to 20 minutes. And also, while he or she is sitting in the tub, we as nurses must observe the patient at least every 5 minutes. Why an observation is required? It is required in order to be able to find out if there is development of complications such as burns and fainting. And sometimes you may even encounter patients who will be feeling sleepy because of the sedative effect of Sitz Bath. Here, that is the reason care must be taken in order to prevent falling and fainting. So here it is very important that we must observe the patient for every 5 minutes. And once the duration is over, then we can assist the patient in patting themselves dry as well as in helping them put on their clothes to prevent chilling. We must provide a comfortable position to the patient. We must replace back all the articles which was used after it has been washed and sterilized. Then only we can wash our hands in order to prevent the transmission of microorganisms. And at the end, we must document the procedure in the nurse's record sheet. So these are the various steps that we need to follow while we are performing this procedure. So now we have come to the end of this topic, whereby in this session we have discussed about Sitz Bath. We have come to know what do we mean by Sitz Bath, what is the purpose, what are the general instructions, what are the solutions that can be used, for whom is this contraindicated, as well as we have discussed regarding the preliminary assessment, the preparation of the patient as well as the environment, the various steps that we need to follow while performing this procedure, as well as the aftercare. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.